what we're going to talk about just is practical supports. And the first one is FTD carer support groups. So a number of you in the audience may already be in an FTD carer support group. And there was also a question about support groups specifically for language variants, which Camille, our speech path, is going to answer. So in Australia at the moment, the FTD specific support groups are run by Dementia Australia, and they're run in 3 states, in Tasmania, Victoria and New South Wales, and there's plans for support groups across the whole of Australia as well. And so they were set up in recognition that caring for someone with FTD has very unique challenges and is quite different from caring for someone with Alzheimer's disease. And that's mainly because of the very significant differences in behaviour, and also that it's a young onset dementia, so people are caring for someone in midlife. It's been shown in a lot of research that caring for someone with FTD, there's a much greater carer burden than there is in other types of dementias. And carer support groups work by thinking that everyone is in the same boat, that people that are experiencing and caring for someone with FTD feel that they get it and they feel understood when they attend. Okay. So what are the goals of carer support groups? So there's the group therapeutic effect, and for people that have been participants in support groups, probably they learn the most from the other people actually in the support groups that have been caring. And so people from the very beginning of their journey right through to the very end can help and support the younger or the more inexperienced carers along their journey. And it's that mutual support and understanding which is thought to be so effective. It's thought to also build capacity and strength, and also educate people about the different changes in FTD and what to expect next. I'm now going to get Dana Fail just to talk about some of the practical agencies and supports that are required for people with FTD. So I'll just hand across to her now.
Hello again. The National Dementia Helpline, or Dementia Australia, is a support that we at the Royal Melbourne utilise quite a lot. The phone number is up there, and it's just a generalised phone number, and that is a intake phone number for all the supports that they offer, which is really a one-stop shop to be linked into groups, counselling, support. Their website, which is down the bottom, has got a really amazing amount of information that's very, very easy to find, very, very easy to locate, and really informative, and in language that's very, very easy to understand. The other thing that they do is if the person that you are caring for is under 65 and eligible for an NDIS package, they can help you through that sort of service system of how to access supports for those that still find NDIS a bit tricky to navigate. Dementia Support Australia is previously known as DBMAS, or Dementia Behaviour Management Advisory Service, although it is still part of their service. It's run by Hammond Care. Anyone with a diagnosis of dementia or a suspected diagnosis of dementia is eligible for their service. They are Australia-wide, and particularly they have a focus on people in remote areas. They can they look more at capacity building and management plans for people that are struggling with symptoms of dementia. They can do face-to-face assessments, video conferencing, phone assessments, and they can also work with health professionals in residential care, or sometimes in hospital units, to come out and put together a management plan for someone that might be struggling. Their phone number's there and their website is there. They do say that they'll have a 7-day response, so if it's very, very urgent, they might provide a 24-hour response. Something that's not so urgent, they may take up to 7 days, but they're a very good support to know about for healthcare professionals and for families. The NDIS, I'm going to try and do this quickly. It's not really possible, but I'm going to try. The National Disability Insurance Scheme is what used to be the Department of Disability Services. and it is for people who are under 65 years old with a disability, and dementia is included under that. The website is up there, and it's quite a self-explanatory website. But generally my experience is if you can get a good support letter from your health professional, like an OT or your doctor or a social worker, you generally will be able to access a decent plan. And that can include anything. If you're creative enough, you can sort of try and get a whole lot of things in your plan, including funding to go to the gym, funding for home modifications, general carer support, general personal care support, transport, carer respite, behaviour support planning, as is written on the slide. My Aged Care is for people over the age of 65. That's when we get an aged care assessment, and that's a one-stop shop through that website there, and that is for services for people over 65. Probably NDIS is probably got more money in it now, but My Aged Care is unfortunately the only way we can do if your diagnosis is occurs after the age of 65. And public mental health services, allied health professionals, GPs, psychiatrists, neurologists, geriatricians, nursing, dementia specialists. I think Wendy's written gold, which means use those services if you can. And if you're desperate, or if it's on a weekend, or if you can't access anyone, there is no shame in calling 000 or turning up to a public emergency department to get some support if you can't access it elsewhere. Can't see that slide. This is a slide, and you might be able to get access to it, which I can't even see what it says, but I think it's a framework of where to go and what to do according to how old you are, I think. Here are some other supports: the Australian Frontotemporal Dementia Association, American FTD Association, and the Rare Dementia Support website, which will have some more information for you that you might find useful. Wendy, do you want to talk about these forums?
Yeah. Hi all. So look, really these are just chat forums for people with FTD, and all of this information will be on the website. Other supports, so ECDC, Eastern Cognitive Disorders Clinic, if you live in Victoria. There's a variety of different memory clinics across Australia that support people living with FTD, and there's a list of them on different websites, particularly for people that have language variant dementias such as semantic dementia and PNFA. Some of the aphasia associations and speech pathologists can be extremely useful, and also obviously Frontier has done a huge amount of research in Sydney at the Brain and Mind Centre. So this is just a quote from Heather, who's one of the carers in the Tasmanian group, and I'll read this quote out now. So this is about her experience of attending an FTD carer support group. As soon as he was diagnosed, I got in touch with Dementia Tasmania. The FTD carer support group has been a lifeline for me. To share with others who understand and to have that quality time is a blessing. I draw strength from others' stories. Several are dealing with far more than I, and with such dignity and willingness. We enjoy the time together. We laugh, cry, relax, and are aware that we're not going through this alone. So I thought that that was probably a nice quote to end on. So look, I'll stop sharing our slides now, and I'll just check if there's any questions.
Hi, Wendy. Thank you so much for that. There's just a couple of questions here that you might be able to briefly answer. One of the questions was, if you're caring for someone with FTD and they're still capable of showering, toileting, making breakfast and lunch, but you feel like you're in need of a break, what would you suggest since an aged care facility doesn't feel appropriate?
Yeah, sure. Look, I might get Diana, who's our social worker, to answer that. Just one second.
I think the best way to manage that, if you just wanted a one-off break, would potentially ask a friend or a family member. If that's not going to work, you could get informal services. There are a whole lot of services online, apart from the ones that we spoke about, where you can just get one-off help. There's a website called Mable, which sort of works like Airtasker, except it's for carers, and you can see, and it has people that provide care, and you can see all their qualifications, male, female, what languages they speak, and you could access intermittent care through there. If you wanted something more ongoing, depending on the age of the person that you're providing care for, I would start looking at perhaps getting an NDIS package or an aged care package to get some more planned and structured care to give you regular breaks. I hope that answered the question.
Great, thank you for that, Dana. And there's just one more question. So someone would like to know why residential facilities aren't generally suitable for people living with FTD. So is this due to staffing levels, training, support, or unsuitable environment? And they'd just like a little bit more information and direction on that.
Yeah, I think Sam Loy mentioned that in her talk. I think perhaps what she meant was that generally with frontotemporal dementia, the person with dementia can be younger. Generally, you have to be over 65 to access an aged care residential service. So sometimes people under 65 may struggle a bit more in a aged care facility because there's no one of their age. Perhaps the activities aren't structured around what their needs are. But I think with the onset of NDIS now, if you have an NDIS package, you can still go into permanent care but keep your package, which means that you can still have NDIS workers going in to see the person that you're caring for and doing some more age-appropriate activities with them or taking them out and still doing things that they may enjoy. And there are now starting to be some aged care facilities which cater towards the younger people, not as many as I'd like, but there is becoming more awareness in the community of a need for residential care for people who aren't, who are reasonably young.